All right, so we are wrapping up Lenny's 8 weeks, and we haven't done a video for a little bit, so she's got a lot to talk about, and she's going to tell us maybe today about some of the frustrations of working with patients that have gone through the conventional medical model or gotten information off of the internet or from experts, and what it's like to do patient education with them.
Yeah, so recently, as I've developed sort of a larger caseload of my own, I've had to do more of that patient education for patients coming in who have seen typical PTs. They've been told their entire life that if they feel tight, then they should go get a massage or go see a chiropractor. And so we've had a lot of those lately. And so when they come in, it's definitely hard, or it was hard to sort of convince people to buy into the 180 system. It's gotten a lot easier for me as I'm learning myself, explaining how the 180 system is different, how we're activating muscles as opposed to all of the other methods which turn them off completely. They target the areas where there's pain, which is hardly ever the place where there's actually dysfunction happening. So as we get patients to sort of realize that as I'm treating them and they have pain, say on their posterior shoulder, and then I'm treating their internal rotators and they feel better, I sort of have gotten to the point where I'm comfortable explaining to them, like if you were at a massage clinic, they would go and poke around at the areas where it's painful, not where the area that is actually needing to be treated. So that sort of has gotten through to some people, and they've gotten a lot more comfortable buying into the 180 system, doing their exercises here and ditching the old methods.
So talk about when they come back, so that's like on a first visit, when they first hear this, oh, I've never heard that before, and doing the education. So when they come back for subsequent visits, second, third visit, that kind of thing, talk about how much easier it is and the reaction that you get from them when they say, I stopped doing what you said to, and...
Yeah, so we'll have a lot of patients come in, and sometimes it's harder for them to ditch their old ways, but as soon as they do, they say like, oh, I stopped getting a massage and instantly felt like I was getting better with my exercises that you had given me. Things felt easier, my back, my shoulders felt better, as opposed to just feeling good in that like 30 minutes or whatever during a massage.
So you talked about patients' initial reaction. Now, think back to 8 weeks ago when I started telling people that and you're like, what is he saying? And so think about, as your point of view from a student, what you learned in school, what you had been taught, what you did on other clinicals, like give us your point of view of how things are, you think differently now than you did 8 weeks ago.
Yeah, for sure. I think that definitely hearing that, like our patients, me as a student going through PT school, I was surprised, I guess, at some of the things that you would like not recommend to patients, massage, for example, or stretching. And I think that after being in the 180 system, going through and learning so much, I have seen firsthand how well it works and how effective it is. And patients' reactions, again, they quit going to their massages, they do the things that we are training them to do, activating muscles as opposed to shutting everything down, and seeing really good results.
Cool.
So, yeah.
All right, so there's week 8 wrap up. She's got 2 more weeks and getting pretty independent on her own, so check back and see what she does over the next 2 weeks.